It's no exaggeration to say that heart health is the most important thing for everyone's well-being. If only I had known earlier that symptoms in the neck or legs could be signs of heart problems, I could have gone to the hospital for a checkup. The longer you spend sitting, the higher your risk of death becomes. That's our conclusion. Thinking that it was good for me, I worked hard to move my body, but it turned out that those actions were actually unhealthy. Let's make sure we don't end up like that. So this time I want to talk about the kinds of symptoms that should prompt you to go to the hospital for a checkup. I will explain unexpected SOS signals from your heart from a doctor's perspective. Thank you for watching this video. So that you can live your life to the fullest and be yourself until the very end. The heart is extremely important. If your heart becomes weak, you may get out of breath, easily feel chest pain even with slight movement, your heart may pound irregularly, your legs may feel heavy, and you might not want to leave the house. For everyone's health, it's no exaggeration to say that heart health is the most important thing. So, this time I want to talk about the kinds of symptoms that should prompt you to see a doctor. I will explain the unexpected SOS signals from the heart from a doctor's perspective. In February 2024, it made the news that the world-renowned leader Sho Ozawa passed away due to heart failure. And not only that, actress Mayuki Kamibe and actor Takeyoshi also lost their lives due to heart failure. I never would have imagined. If only I had known earlier that symptoms in the neck or legs were signs of heart problems, I could have gone to the hospital for a checkup. Please listen until the end so you won't have any regrets like that. Now, here is today's agenda. In the first part, I will introduce 6 signs that appear when your heart is in bad condition. In the second part, I will talk about how walking can help prevent hardening of the arteries in the heart and just how effective walking can be for your health. In the third part, I will discuss the other side, what happens if you walk too much. Overdoing exercise can be risky, which I will discuss. Lastly, for those who start enthusiastically but quit after a few days, I will share a personal exercise method I practice and recommend. At YouTube Medical University, you can become healthier starting tomorrow. We share easy to understand responsible medical information from a doctor's perspective. Subscribe to our channel to stay updated with new videos. Let's begin the explanation. There are 6 signs that your heart is not in good condition. The first one is getting tired easily, which I've seen in my outpatient clinic. A woman in her 50s visited my clinic complaining of fatigue at work, inability to do housework, and not leaving home on days off. She suspected menopause or thyroid issues, but it was ultimately discovered that her heart was not in good condition. Heart disease can affect people in their 50s or younger, not just others. Even from a young age, conditions like congenital hypertrophic cardiomyopathy or arrhythmia can cause heart problems. After undergoing various tests, it was discovered that the person's heart was in poor condition. In a state called heart failure, I referred the patient to a specialist. The heart is a pump that sends blood throughout the body. It carries oxygen taken in from the lungs in that blood, and also nutrients absorbed from the intestines. It carries nutrients throughout the body. Thanks to that, oxygen and nutrients are delivered all over our bodies, allowing us to live like this. If the heart becomes weak, nutrients and oxygen can't be delivered throughout the body. So for example, when you exercise a little, the amount of energy and oxygen you need increases. But if the heart can't keep up with that demand, you get tired easily and have to rest more often. Of course, just because you get tired easily doesn't always mean your heart is bad. Other causes of fatigue can include menopause, anemia, or thyroid issues. Diseases in which hormones responsible for the new metabolism decrease, depression, malignant tumors, and various other causes can be considered. If you've been feeling more tired than usual lately, or if your fatigue is getting worse, please be sure to consult a hospital. Regarding menopause or depression, the video is posted in the summary section, so please watch it if you like. 6 dangerous symptoms that appear when your heart is in bad condition. The second one is this: going to the bathroom at night. Does anyone here ever get up to use the bathroom at night? Getting up once nightly to use the bathroom? Even just that is considered nighttime frequent urination. Of course, if you only get up once, it usually doesn't make you sleepy or cause problems during the day. There's no particular stress, and for people like that, it doesn't mean they need immediate treatment. However, this nighttime frequently getting up at night to use the bathroom could potentially indicate heart or kidney problems. It could also be a sign when we're up and about during the day, our legs are lower than the rest of our body. Because of gravity, excess fluids tend to accumulate in our legs. However, what happens when we're lying down at night? The height of your heart, your head, and your legs are all level when you're lying down, right? In other words, the fluids that had accumulated in your legs during the day return to your heart and circulate, which increases the amount of fluid in your blood vessels. As a result, you end up producing more urine. So why is that? Why is it that people with heart problems or heart failure are more likely to experience this kind of phenomenon? That's because when the heart is weak, like in heart failure, it can't work as hard during normal activities, which causes blood flow to stagnate and makes it easier for fluid to accumulate in the legs. Also, for a weakened heart, lying down like this actually reduces the burden on the heart, doesn't it? It's not that the blood flows up or down like this, but when you're lying down, the blood flows through horizontal blood vessels. That's the image you should have. In that position, the burden on the heart is reduced and the heart's pump works more efficiently, so more blood reaches the kidneys, and as a result, more urine is produced. I think it's easier to understand when you consider the reason behind it. Actually, this increase in nighttime urination is called nocturia, but people with kidney problems also experience increased nighttime urination known as renal nocturia. For those with kidney issues, it's harder to produce urine, so fluid tends to accumulate in the body. At night, that fluid returns to the heart, which leads to more trips to the bathroom. So please remember that both the heart and kidneys are involved in this process. Besides that, there are other reasons for waking up at night to use the bathroom. There are various causes. For men, a well-known cause is benign prostatic hyperplasia. For women, the most common issue is overactive bladder, which is a condition where the bladder becomes overly sensitive. I've already made a video about nocturia in the past, so if you're interested, please check the summary section. I've also introduced some stretching methods to help improve nocturia, so please give them a try. There are also some unexpected symptoms that can appear when your heart or kidneys aren't functioning well. The third sign is experiencing shortness of breath or coughing at night. When you hear about shortness of breath or coughing, you might think of lung diseases. Some people may suspect they have a cold or asthma. However, in reality, experiencing shortness of breath at night can be a sign that your heart or kidneys aren't functioning well. So, why does this happen? Why do you experience shortness of breath or coughing at night? The reason is similar to what I explained earlier. When your heart or kidneys aren't functioning well, blood circulation becomes sluggish, and during the day, fluid tends to accumulate in your lower legs. At night, when you lie down and your legs are level with your body, that fluid returns to your blood vessels. As a result, the amount of blood suddenly increases, and if your heart or kidneys are already weakened, they can't handle the extra blood flow efficiently. This causes congestion, especially in the organs located just before the heart, which is the lungs. Our bodies receive oxygen from the lungs, and that oxygenated blood returns to the heart. So when congestion occurs in the lungs due to poor heart or kidney function, the lungs become overwhelmed by the excess blood, leading to symptoms like shortness of breath or coughing. As a result, the lungs become congested, and because of that, the exchange of oxygen and carbon dioxide doesn't work properly. At night, you may wake up because you're having trouble breathing. This kind of symptom can occur, and for the same reason, when congestion builds up and irritation occurs, it can cause you to cough. Please remember that. In this way, suddenly waking up at night because you can't breathe and then coughing, this is medically called nocturnal paroxysmal dyspnea. The term is difficult, so you don't need to memorize it, but it means your heart function is poor. Please remember that there is a possibility of heart failure. Of course, having trouble breathing at night and feeling distressed isn't caused only by heart problems. As I mentioned earlier, it could also be due to asthma, and surprisingly often, it's caused by something called sleep apnea syndrome. This is when your breathing stops while your brain is asleep. For example, your airway might collapse, or physically, if you have a small jaw or large tongue while you sleep, the structure of your bones or the presence of fat can make it easier for your airway to become blocked. Because of that, your breathing can stop at night, making you feel distressed and suddenly wake up gasping for air. These kinds of symptoms can appear. In any case, if you wake up at night feeling distressed, it's a sign that you should go to the hospital, so please consider getting a medical checkup. Now, here are 6 unexpected signs that can appear when your heart is not in good condition. The 4th one is the swelling of the blood vessels in your neck. You might wonder why the blood vessels in your neck swell when your heart is not working well. If you're thinking about that, and if you've watched the video up to this point, maybe you already have an idea why the blood vessels in your neck swell for this reason. I think some of you might have thought that as well. As I mentioned earlier, the heart receives blood from the entire body and pumps it out to circulate throughout the body. So when the function of the heart gets worse, blood tends to pool in front of the heart. And because the head is above the heart due to gravity, when blood flow returns upward and pooling occurs, the blood vessels in your neck become more visible and swollen. If you're watching this video, I encourage you to check your own neck veins in a mirror, either now or after watching. Please take a look at this image as well. The appearance of the neck. There is a vein called the jugular vein. When this vein is swollen, it could possibly be a sign that your heart is not in good condition. As blood returns from the head to the heart more easily, anyone can experience swelling of the neck veins. So, if you notice that your jugular vein is swollen when you're lying down, medically speaking, that's not considered abnormal. However, if you notice that your external jugular vein is swollen when you are sitting upright at a 90-degree angle or standing like this, it could possibly be a sign that your heart is not in good condition. Swollen neck veins could be a sign of an issue, but it's not always abnormal. A doctor's examination is needed to determine if there's anything concerning. So, if you're feeling anxious, it might be a good idea to visit a hospital and consult with a doctor. For some people, the swelling of the neck veins may not be a sign of heart problems, but rather a sign of lung problems. This is because people with chronic lung issues can develop something called pulmonary hypertension, where the lungs are under strain and blood flow in the lungs worsens, causing blood to pool and the veins to swell. For example, people who have damaged their lungs from smoking too much, or those with interstitial pneumonia or other lung diseases, may experience constant swelling of the neck veins due to the effects of their lung condition. I've posted a video about interstitial pneumonia before, so check it out from the summary section if interested. Now, let's discuss 6 unexpected signs of poor heart health. The 5th sign is crucial, so everyone please monitor your heart health closely. Have you ever experienced something like this? There are many patients who come to the clinic saying they feel palpitations like this. However, what I want everyone to learn here is that what you think of as palpitations can actually be caused by a variety of things. For example, some people say their heart is beating fast and call that palpitations, while others don't necessarily have a fast pulse, but feel each heartbeat very strongly. And some people don't have a particularly fast pulse, but feel like their heartbeat skips. Some people feel like their heartbeat skips, which makes them feel uncomfortable, and they call that palpitations as well. I highly recommend that whenever you feel palpitations, you try to check your own pulse. One of the easiest places to feel your pulse is at the radial artery, which is located at your wrist. It's the area on the thumb side of your wrist. Place your fingers there. Try pressing down like this with your index, middle, and ring fingers. How is it? Were you all able to feel your own pulse? This is called self-pulse checking. I recommend that you get used to feeling your own pulse regularly so that when you experience palpitations, you can check your pulse yourself. By doing this, you can tell whether your pulse is fast, or if it just feels strong but isn't actually fast, or if your pulse is skipping. Being able to make these distinctions will help you provide accurate information when you visit the hospital, which can lead to a quicker and more accurate diagnosis. I actually instruct my patients to do this as well, so please give it a try. When your heart condition worsens, palpitations are often characterized by a faster pulse or skipped beats. When the heart is not functioning well, it can't contract properly, so it tries to compensate by beating faster. Also, if your pulse is skipping, there is a possibility of an irregular heartbeat. When the heart contracts like this through the flow of electricity, but if there is an abnormality in the electrical flow, the heart can't contract in a regular rhythm, and your pulse may skip like thump, 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 thump. If you leave this arrhythmia untreated, it can cause you to lose consciousness and collapse, or it can overwork your heart and gradually decrease its function, so it's dangerous to ignore it. If you continue to have palpitations, please check your own pulse, and if you notice anything unusual, please consider seeing a doctor. Also, the cause of palpitations is not always just the heart. Many people come to my clinic and say, "Doctor, I had palpitations and went to the hospital, but they told me my heart was fine and sent me home, but I still have palpitations. What should I do?" I get this kind of question a lot. Besides the heart, other causes of palpitations include anemia, which can cause palpitations, or the body compensating for a lack of oxygen throughout the body. There are cases where the thyroid gland is overactive, such as in Bastow's disease, which can cause palpitations. Palpitations can also be caused by psychological factors, such as panic disorder. Even if your heart has been checked and found to be fine, these possibilities still exist. So if your symptoms continue, please visit the hospital again and let them know about your concerns, even if you were told your heart is not the problem. I've attached the video in the summary section, so please watch it if you like. Here are 6 unexpected signs that can appear when your heart is not healthy, and the last one is swelling in your legs. If you've listened to the explanation so far, you probably already understand about leg swelling. The reason I introduced these signs is because I want everyone to try checking for them themselves. It's actually difficult to judge whether you have swelling in your legs just by looking at them. There is a method to check for swelling by pressing on the bony area called the shin bone on your leg. Please take a look at this photo. Everyone, don't you have a spot on your shin where you can easily feel the bone? Please try pressing that area firmly for 10 seconds. If you press down hard for 10 seconds, even if your leg didn't look swollen at first, you might notice a dent left behind after you release your finger. I think some of you may experience this. This is called pitting edema of the lower leg. When your heart is not working well, the pumping action weakens and fluid leaks out of the blood vessels into the lower part of your body, which is most affected by gravity, causing your legs to swell. And interestingly, after pressing for 10 seconds and releasing, the speed at which the dent returns can help determine whether the cause is related to the heart or something else. If you press on your shin for 10 seconds and it takes more than 40 seconds for the swelling to return to normal, there is a high possibility that the swelling is caused by problems with your heart or kidneys. If the swelling returns in less than 40 seconds, it suggests that the swelling is caused by something else. For example, if the swelling is due to a thyroid problem, it will return immediately without leaving a dent. And if the swelling returns in less than 40 seconds, it could be due to malnutrition, liver problems, or even cancer in the body. These conditions can affect the amount of protein in your body, especially a substance called albumin. And low levels of albumin can cause swelling. I encourage everyone to try this test on your own legs and see how quickly the swelling returns. Please try counting the speed. Just by trying this simple test, you might be able to detect abnormalities in your own body or in the bodies of your family members and loved ones at an early stage. Now let's review what we've covered so far. We talked about 6 unexpected signs that can appear when your heart is not healthy, and the first one we introduced was feeling tired easily. When the heart, which acts as a pump to send blood throughout the body, stops working properly, blood circulation worsens and you become more easily fatigued. The second sign we explained was an increase in the number of times you need to use the bathroom at night. This happens because the fluid that accumulates in your legs during the day returns to the heart at night, causing the kidneys to produce more urine. The third sign is experiencing shortness of breath or coughing at night. We introduced paroxysmal nocturnal dyspnea, which is difficulty breathing that occurs at night. This happens for the same reason as frequent nighttime urination. At night, blood flow increases and the heart can become congested, causing fluid to accumulate in the lungs, which are located in front of the heart. This leads to shortness of breath and coughing. The fourth sign we explained is distended neck veins, which can be seen when sitting or standing. This happens when the heart is experiencing congestion. The veins in your neck are easy to see and can be a sign that helps you notice abnormalities. The fifth sign we explained is changes in your pulse. Check whether your pulse is fast, strong, or irregular. Please try checking your own pulse and monitor your condition yourself. If you notice anything unusual, visit a hospital and consult a doctor. The final sign explained is swelling in the lower legs. Check for swelling by pressing on the shin bone for 10 seconds and seeing if the indentation remains. Try this method introduced in the video. Coronary artery disease is a condition where the blood vessels of the heart become narrow, causing chest pain. Even the popular talent Kaneko Kin-san experienced this condition. There is a video on YouTube where he talks about his real-life experience with this illness. Please be sure to check the comments section or the description after watching this video. Do you all know about the exercise unit called metabolic equivalent of task S? It's an indicator that shows the amount of physical activity. Sitting quietly is considered 1 metabolic equivalent of task, and walking at a normal pace is considered 3 metabolic equivalent of task S in terms of exercise intensity. Jogging is said to be 7 metabolic equivalent of task S, and climbing stairs is said to be 9 metabolic equivalent of task S, walking at 3 metabolic equivalent of task S. If you do this exercise 5 times a week, that's 3 mets times 5, which equals 15 mets of exercise. It's said that people who exercise 15 mets per week have a 30% lower risk of death and diseases like cardiovascular blockage compared to those who don't exercise. It lowers mortality rate and reduces risk factors like high blood pressure, diabetes, and lipid disorders that can cause arteriosclerosis by clogging blood vessels. Exercise is the only thing that has solid data showing it can improve these conditions. So when you go to the hospital and the doctor tells you to exercise, but you just can't seem to do it. I'm sure many of you have experienced that, right? And then Japanese people are globally recognized for their diligence and hard work, and it's well known that they have one of the longest daily sitting times worldwide. When asked if they sit for an average of 8 hours a day, 38% of men and 33% of women answered yes, meaning that these people spend as much as 8 hours just sitting. This is quite a long time even by global standards. Furthermore, according to an analysis that summarized 34 studies on the relationship between sitting time and mortality rate, the conclusion is that the longer you sit, the higher your risk of death becomes. It is said that the increased risk of mortality can be reduced by exercising for more than 60 minutes a day or by making sure not to sit for more than 30 minutes at a time and taking a break every 30 minutes. There is data showing that taking a break every 30 minutes can help improve the increased risk of mortality. There is also data showing that blood sugar levels improve and triglyceride levels decrease. Moving your body regularly like this is extremely important for your life, but on the other hand, you also need to be careful not to overdo it. Especially for those watching this video, I think many of you are very health conscious. If you push yourself too hard thinking it's good for you and keep moving your body, it could actually become an unhealthy behavior. Let's make sure that doesn't happen. Now let's review the second period, sitting quietly. The exercise intensity was equivalent to walking at a moderate pace, about 3 mets, exercising at 3 mets. When people walked for 5 hours a week, their mortality rate dropped by as much as 30% compared to those who didn't. In other words, if you walk for 5 hours a week, there's a possibility that your mortality rate will decrease. Also, Japanese people tend to spend a long time sitting, and sitting for long periods is linked to an increase in mortality rate. Taking a break every 30 minutes. On days with prolonged sitting, exercising for about an hour can help improve the increased mortality rate linked to extended sedentary time. That's what I wanted to share. Exercise is of course good for your health. However, even if someone tells you to exercise 3 times a week or walk for an hour every day, it's hard to keep it up, isn't it? To be honest, I'm also someone who hasn't made exercise a habit. I try to exercise at least twice a week, but the reality is that it's hard to keep it up. So, I have a suggestion for all of you. Actually, I want you to know that even just taking 1 step a day counts as exercise and can have positive effects. Even if it's just once a week for 10 minutes, simply exercising will bring health benefits. At your health checkup, if you've been told that your cholesterol, blood sugar, or blood pressure is high at your health checkup, you may have received nutritional guidance from your doctor or a health nurse. Isn't it common that even if you decide to work hard and exercise for an hour on your day off, before you know it, that habit fades away? You might find yourself making excuses like, work is really busy this week, or it's a bit too windy today, and end up skipping it. I used to think the same way. Once I skipped even once, the tension disappeared and I started thinking it was okay to skip again or start over the following week. And before I knew it, a lot of people end up forgetting about exercise before they realize it. For people like that, what I want to suggest is not to push yourself too hard, but to start exercising within a manageable range for a short period of time. In a joint study conducted in Poland and America, they analyzed 226,000 people from around the world and reported that just 2,300 steps a day had a positive effect on the heart and blood vessels. It takes about 10 minutes to walk 1,000 steps. So if you walk for 10 minutes a day and then walk back for another 10 minutes, just those 20 minutes can actually lower your risk for blood vessel problems. It's been shown that this can make you healthier. In Japan, many people are highly health conscious, and devices like pedometers have gained popularity. The manin manpoki pedometer means 10,000, so people tend to set high goals like 10,000 steps a day. However, for older people, walking 10,000 steps a day may not be necessary. In a study of 4,165 Japanese people aged 65 and over those who walked less than 5,000 steps a day reduced their risk of death by increasing their daily steps by 1,000, the risk decreased by 23%. However, for those who were already walking more than 5,000 steps, increasing their steps beyond 5,000 did not provide additional health benefits, according to the report. In other words, for older people, walking up to 5,000 steps a day has health benefits, but walking more than that doesn't seem to provide much additional benefit. Other studies have also shown that for older adults, walking between 5,000 and 7,000 steps a day brought health benefits, but even if they walked more than that, there was no relationship between the number of steps and mortality risk. In other words, walking more than that did not provide additional health benefits, according to some reports. Furthermore, it's important to note that too much exercise could actually be dangerous. There are even reports suggesting this. A study conducted at Harvard University reported that people who exercised enough to burn about 3,500 kilocalories per week actually had a higher mortality risk compared to those who exercised less. Since 10 minutes of exercise burns about 30 kilocalories, to burn 3,500 kilocalories through exercise, if you exercise every day, it would mean walking about 16,000 steps per day. In other words, walking 16,000 steps every single day. If you walk that much for your health, it might actually mean you're burning too many calories and could be increasing your risk of mortality. What you need to be careful about is the amount you burn. There haven't been any experiments in calorie-related studies to see if walking actually increases mortality risk, so this is only an estimate. But whether it's walking or playing sports, it's still important to be careful not to overdo it. You should always adjust your exercise to match your own physical strength and age. Even in my clinic, there are many people who end up trying too hard and start having knee or back pain. Doing anything too much can be harmful. I strongly recommend that you find the right intensity and amount of exercise that suits you. Now, let's review today's 3 main points. Just walking 2,300 steps a day, going out and coming back, is enough to lower the risk of cardiovascular disease. And especially for older people, even if you walk more than 5,000 steps, there are few additional health benefits, and rather, I explained that exercising too much, such as walking more than 16,000 steps every day, could actually harm your health. Miss I, a woman in her late 70s who visits my outpatient clinic, enjoys park golf 3 times a week with her husband. Miss I says this: "I'm not really good at sports, but I enjoy park golf, and my husband likes it too, so I can definitely keep exercising without missing it. It's true that with park golf, you can chat with friends while playing, and you get to walk a lot. If you go with someone else, you feel like you have to play with them, so there's a bit of pressure that helps you keep going. Before you know it, you're exercising while having fun. People who keep up with exercise often seem to do it this way. So, when you start exercising, don't do it alone if you can help it." I suggest setting rules and rewards for yourself to stay motivated even if you're doing it alone. At YouTube Medical University, we share videos from a doctor's perspective to help you get healthier. If these videos motivate you, please subscribe to the channel. A book has been published that summarizes the healthy habits learned from patients just like Ms. I, who successfully incorporated exercise into her daily life. Please check it out if you're interested. So please look forward to it. Now, let me share with you what kind of exercise I actually did, how I built muscle, and whether I was able to successfully lose weight. I'll also introduce some recommended methods for effectively building muscle and creating a body that's easier to slim down. So please listen until the end. In fact, using this method, I managed to lose 3 kilograms in just 1 month. Before that, I had a series of setbacks. I wasn't particularly fond of exercise, so every time I tried to start, I couldn't keep it up and ended up failing again and again. However, after discovering an online fitness service called LeanBody, things changed dramatically. I was introduced to this service by a company, and to be honest, I tried it with some skepticism, but once I started, I saw my body change rapidly. So I felt I had to share this with you. Making exercise a habit is a huge health benefit for anyone, so this time I wanted to introduce it to you in particular. This LeanBody. The biggest feature of this service is that it's fun, so users say they can keep exercising because they enjoy it. You can continue while having fun. I thought I could maintain exercising for just 10 minutes a day. Now, if I miss a day of exercise, I feel like something is missing. That's how much I rely on this service. You all might already know this, but it was popular before. There was that Billy's Bootcamp craze before, right? In this service, Billy himself actually teaches the lessons. But when you hear Billy's Bootcamp, don't you get the impression that it's really intense and that you'll be forced to do tough training? However, in this LeanBody service, it's the Reiwa era version of Billy, so the lessons are prepared to be much gentler, and even someone like me who doesn't usually exercise was able to keep going surprisingly easily. And as I mentioned earlier, the meal management features are also well developed. I use it to manage my protein intake. In addition, you can also record external workouts and your weight besides the lessons, so I was able to visualize my exercise progress. In fact, when I tried LeanBody for a month, I started to see changes in my weight. Rather than being desperate to lose a certain number of kilos, I wanted to build muscle and maintain a healthy body. And I actually enjoyed it so much that I was able to keep going every day. As a result, I lost about 3 kilos in just 1 month. For those concerned about their body shape or weight, I highly recommend using LeanBody for dieting. For more details, for more information, check out my previous video introducing LeanBody. The summary or comments may help if you found the content challenging. Please listen to it as many times as you need, take notes and try to remember it. Also, if you have any of the symptoms I talked about today and are worried, please visit your nearby circulatory medicine department or your regular doctor. It's recommended that you consult with your usual doctor or your primary care physician. In order to live a healthy and fulfilling life as yourself through the second half of your life, on YouTube Medical University, we explain things that are hard to understand elsewhere and that you won't be taught at the hospital. We explain important knowledge about preventive medicine and your body from a doctor's perspective. If you find this helpful for your future, I would be happy if you could press the good button or subscribe to the channel. Also, please feel free to share your thoughts in the comments or let us know if a doctor has told you something similar or if you have any symptoms. Please share your experiences. Well then, see you in the next video.